Can everybody see my fancy little slideshow presentation? Anybody?
I can see it.
Yes.
Perfect. Okay, thank you. So, whoops, let me move this over here. All right. Oh, good. I can see it now too. Perfect. So I put a little something together just to kind of, as you know, this is a huge task, right? Well, I guess, first of all, I should start by introducing myself because I don't know if everybody that is on today was actually on our meeting last time. So I'm Tiffany Nicolette. I'm the Vice President of Housing and Services for CHI, and I am working with Izzy to chair this amazing committee of experts around affording longevity. And so this is our second meeting. Happy Friday to everybody. I know it's a rainy Friday, but it's also a purple Friday and the O's are in the playoffs. So I am feeling very good and excited about today, especially because we're going to really start getting into the meat and potatoes of this Longevity Ready Maryland and, starting to work on kind of developing a plan or some objectives. So meeting protocols. So I pulled these meeting protocols from the work group packet that was sent out. So making sure that when we're here today, everybody is removing distractions, really committing to actively participating, because after I'm done speaking, we're going to go into subgroups where you guys are going to start really hashing through some things. And we're going to talk a little bit more about what that's going to look like. But we want to make sure that we're not distracted. We're really actively participating, speaking one at a time, respecting each other, listening to what the others are saying, and when possible, really developing a consensus because we're going to need that to move forward. I'm also throwing in here a couple of tips that I think for success. So during our conversations today, I think that we really need to be comfortable with ambiguity. We don't have to have everything fleshed out right now, right? Like we don't need to worry about the wording. We want to zoom out and really have a big picture view. And we're going to talk a little bit about what those deliverables at the end of our conversations are going to be today. So remember, be comfortable in that gray area. Don't have to have everything planned out yet. So this is something that the stakeholder advisory group kind of chatted about the other day when we met, figuring out the difference between goals, objectives, and strategies, right? So we've got to develop all of these things, and we wanted to kind of further define them. So I don't know if anybody had a chance to look at I think it's called the work group recommendations worksheet. It kind of gives some instructions on the path forward for each of the work groups. But I kind of want to touch on what it means to have goals, objectives, and strategies. What are those different things? So first we have the goals. The goals, you'll see I put these clouds in here to make sure that we're like keeping in perspective what's big picture and then drilling down to, the more like the minutia of how things are going to happen. So the goals are those big picture, it's the desired outcome. It's what guides our direction, and it's qualitative in nature, right? Then we have objectives. So the objectives further down the triangle are how we bring those goals to life. They are right there, the how. This is where our measurable outcomes and SMARTY, using that SMARTY format, are going to come into play. These are quantitative in nature. So we're measuring them. We are able to report out on them. And then we have, furthermore, the strategies. So the strategies are our path to success. They are how we're going to achieve the objectives. They're actionable in nature. People or groups or organizations are going to be able to own them and get them done, really tackle them. So I just kind of wanted to talk a little bit about that to see if that makes sense to everybody. And does anybody have any questions about the difference? Okay, so moving on. This is just a screen capture from our recommendations, the work group recommendation sheet. So our work group already has a goal. The 4 EPIC goals that, you know, are under the Longevity Ready Maryland, our EPIC goal is to prepare Marylanders to afford longevity. Today, we are here. We're going to work on the recommended objectives. And we have identified those 4 priority areas. So we've got the affordable housing subgroup, the affordable healthcare subgroup, financial security, and access to long-term supports and services. And so today we're going to be breaking out into those work groups and talking through what it might look like and how we might use those 4 priority areas to achieve the goal of preparing Marylanders to afford longevity. Doing that, I like to think about things in how might we sort of, you know, like forming it as a question, right? Because that's what gets the conversation going. So thinking about the affordable housing subgroup, these are just the bullet points that I pulled right from the work group packet. So that they're examples or ideas or things to think about, but they're not the only things, right? So affordable housing, when we're in the work group, we're going to ask ourselves, okay, so how might we increase access to affordable housing options? How might we improve housing stability? Or how might we address those systemic barriers that impact housing equity? So the next work group, affordable healthcare, the same sort of thing. So how might we, and then those bullet points right from the work group packet, how might we explore innovative solutions, increase equitable access, promote technology-based healthcare solutions? Financial security. So how might we lift families out of poverty, protect financial and employment security by understanding risk and predatory lending, address retirement inequalities? And then finally, for under the long-term services and supports, how might we improve access to affordable long-term care options? How might we address those long-term care financing and delivery challenges? I'm going to stop sharing my screen, I think. There we go. Stop sharing. And so I just kind of wanted to open it up to questions and make sure that everybody kind of understands what we're hoping to get to today. Today is really about conversation, right? It's about so the first meeting we spent learning about each other, learning about some of the offerings that are out there, the resources, what we each bring to the table, what our passions are. And then today we're going to use all of that we learned about each other and capitalize on it to come up with that direction to meet that overarching goal. So again, going back to our, oh, you guys can't see it, but going back to our goal, which is what is guiding our direction. So with that goal in mind, thinking about how are we going to bring that goal to life today? We don't have to come out of today. So I know that we have only 4 meetings together, right? And we can't solve the world's problems or the state's problems or all longevity problems in the 4 90-minute meetings that we're going to have together. But what we're hoping for today is to come up with a really strong direction, have some really good conversation about these are the things that we want to focus on. And this is how we feel like we experts, because all of you guys are experts in your fields or with your populations. And that's why you're here. You know, you were specially selected to be here because the state needs that expertise. And so using that expertise and that viewpoint, coming into these conversations with an open mind and talking about how are we going to achieve that big overarching goal. Does anybody have any questions or thoughts about that? Does everybody think that's doable? So even if you can come to at the end, so I don't know if anybody had a chance to look at the agenda, but after we break into our subgroups, we're going to come back as a big group, and hopefully the point person, each work subcommittee is going to have a point person, and that person's gonna kind of report out. You don't have to, read everything that, was happening. It's not going to be a transcript of what the conversation was. But what we're looking for is a brief summary and maybe 1 to 2 rough ideas, rough objectives. So we don't have to worry about the wording. It doesn't have to be super fleshed out, but just being able to present that back to the group, because we want to be able to talk it over as a group. We may be able to, we recognize that there's a lot of overlap here, right? So if we're coming through these objectives and figuring out, coming back, reporting to the larger group, you might say, oh, shoot, I bet we could combine this one from long-term supports and services with this from affordable housing and come up with one objective. Because in the end, our work group is only reporting out on 4 objectives. And then the next step, not to overwhelm anybody, but the next step is going to be kind of working through some strategies, but that's going to be in our later meetings. Today, we really just want to have some really good, solid conversation using our expertise to inform our decision for moving forward, and then report out to the group and figure out, are there some overlap, maybe narrowing it down, like I said, to 1 or 2 objectives for each of those subcommittees. See a lot of heads nodding, and I think everybody feels really good about today. I hope so. I feel really good about today. So I think our next step is, we went through a lot of people actually let us know what subgroup or subcommittee that they would want to participate in. Some people didn't, and so Izzy and I took the liberty of assigning you. If you are totally against your the assignment that we've given, please let us know so we can move you to another subgroup. But if you're cool and flexible about it, we'll put you in this subgroup, and we will kind of talk it through. And we are hoping that each subgroup will have somebody who is facilitating that conversation, and then also somebody who's taking notes. Preferably not the facilitator, because I know it's really difficult to facilitate and take notes at the same time. And then either the facilitator or the note taker, well, I guess probably the note taker, if that's okay, will report back to the group, the larger group, what their group came up with, summarize the conversation and present 1 to 2 very rough draft objectives for moving forward.
Okay, and Tiffany, I've shared the screen so that people can see which subcommittee they would be moving to shortly. And JJ is going to give us instructions on how to do that.
How do you switch subgroups?
How do you switch subgroups? Morris, you just let us know which subgroup you would prefer to be in, and we will switch it.
I'd like to be in the access to LTSS.
Okay.
You got it. Morris Klein.
Okay, so that's fine. And I also, Tiffany, just to add on to your direction, we want to also make sure that you all know that we have MDOA staff breaking out into these subcommittees who can take notes if people, if people are not comfortable doing that. So we wanted to just make sure that people are not overwhelmed. What's really most important in this exercise over the next 50 minutes or so is to really share your perspectives, what you think that the subcommittee's main objective should be, ideally, and develop some consensus around that. And there's some questions here. Mike?
Is there an assigned facilitator? Is that who is at the top, or are we just gonna work that out?
At the bottom, can you see where it says staff? So I'm going to be staffing housing. Peter is actually taking Liz's place in affordable health care. I believe Andrew is going to be covering financial security for De'Ara. And JJ is going to be on access to LTSS.
And in terms of facilitators, the person at the top, we are hoping, if they are cool with it, that they will be the facilitator of that group. Again, just like if you aren't happy with your work group, let us know. If you aren't comfortable being the facilitator, please let us know. And we will.
Hi, I might be better. I might be able to make a better contribution in the housing area. I mean, a lot of my work in the federal government was all about housing and affordable housing. I'm also a trained facilitator, if that makes a difference. I don't know.
That was Fran Randolph. Wants to move to
Okay.
the
Yeah.
okay.
To housing. Okay.
And I'm actually going to drop in the chat because I'm pretty sure, I'm not terribly familiar with the Google platform, but I'm pretty sure even once we break out into our subcommittees, we're going to be able to see the chat that we're doing here. And I'm going to drop in there the bullet points from the recommended priority areas so that we can keep track of, some of the how might we questions. So
Yeah, I'm happy to facilitate. Looking back at the work group information resource packet just to see if there's some direction for what top priorities are like within that financial security space.
Wonderful. And I am checking to see if Carolyn is on the call. It looks like Carolyn True is not on the call. So we'll need to have somebody step into the facilitator role for access to long-term services and supports. Okay, so I'm going to stop sharing. And JJ, can you give us direction on how we move to our subcommittee work groups at this point?
Yeah, we just need to create the breakout groups, and it looks like Izzy, you're currently the host to do that, so you can make me a co-host, and I'll build the breakout groups for you. Though.
How do I do that?
The bottom right-hand corner, you're going to see the little people icon, and then you can find my name and hit the 3 little bullets.
This thing, activities?
Oh, and before we go, we have a question from Dan Martin.
Yeah. Hi, everybody. Thanks a lot. Just as and I'm happy to be a facilitator too. But I just have a question for these kind of questions that that have been laid out for the different groups. I mean, if there are, do we have to follow these specific questions? I mean, if there are other things that we want to kind of talk about in terms of, ensuring affordable health care and that don't necessarily fall into one of these questions, I mean, are we free to kind of talk about whatever we want to talk about in terms of making sure that healthcare is affordable, or what?
Absolutely. These were just pulled from the work group packet and they were all suggestions, right? So, because sometimes it's hard to get started. And so these are our starting points, but if it goes somewhere else, if you guys have something in your head that you think is missing here, you want to bring it to the table, absolutely. It's just, I think, really important to make sure that we are keeping things really big picture, right? So just not down to the minutia yet.
Got it. Thank you.
Yep.
JJ, I'm on host controls.
Host controls. Oh, you're back in the meeting management itself. That's fine. Hang
So
on.
what do I do on host? How do I give you the ability to do this? JJ.
I'm still on mute. Sorry. So if you scroll down, so on the left-hand side, if you're already seeing host control, there should be guest. And underneath guest, you should be able to see, co-hosts, contributors, etc.
I don't see that. You're under host controls, it's the far right thing.
You want to share your screen or you just do it together?
Yeah, let's do that. That's not good. I don't know how to do that.
So there's also in the bottom right corner, Izzy, there is a button that's got like a couple, like 3 shapes, and
Yeah.
it says activities.
Yeah, breakout
If you
rooms.
click, yep, if you click on that and click on breakout rooms,
Yeah,
you might be able to, since you're the host, assign folks to the breakout rooms. Right, and unless, because it will only allow the host to do that.
right.
Right.
What do you recommend? Set up breakout.
Either way, it sounds like you have 4 breakout groups, so you can navigate through that to create the 4th. That's fine.
I'm really not comfortable doing this.
What
let's
happened
see.
when you went to people on the main screen, the little people icons
And then,
on the bottom right? Then you would go to the person, scroll down to the person that you want to assign that role to. So scroll down to JJ,
Mhm.
and then click on the 3 buttons to the right.
that's under,
No, okay, sorry.
under the far right where it says host controls.
No, under the far right, where there's a little cartoon 2 people icons.
Yeah.
If you click on that people that has a number 31 next to us, because there
Yeah.
are 31 of us.
Yeah.
And a list will pop up.
Yeah.
And you scroll down to JJ.
Okay, I see, add as co-host.
Yeah.
Okay, I did that.
All right, and then
We're
click
good.
on the 3 buttons to the right, or click on JJ.
I did that. Okay.
And now does it have make co-host?
Yep.
Yay!
Okay. Thank you. Thank you very
No
much.
problem.
Okay.
So for the purposes of time, I just created 4 breakout groups real quickly. Tiffany, do you mind sharing your screen again real quick so we can see the breakout rooms and we just do by number?
Yes. Wait,
All right.
what part are you looking for? What do you want me to share, the contact list?
Yeah, whoever's supposed to go, but it looks like people already figured out. I see people going to breakout rooms where they're supposed to be. So you guys are awesome.
JJ,
I'm here.
how do I go to a breakout room?
The activities button at the bottom right hand corner looks like a square,
Yeah.
triangle, circle, and then you
Okay.
select the room at the bottom by hitting the join button.
I see. Okay. How do I know which breakout is which?
We were just going by number from left to right from Tiffany's Excel sheet there. But
Oops. Do you need me to share that again? Sorry.
So breakout 1 is for housing?
yes.
Okay. All right. Thank you.
Apologies, I'm having trouble finding how to join my breakout room.
That's fine, Anna. I can put you where you need to go.
Oh,
Yeah, me too. I'm
Yeah,
not
me
either.
too.
I
Yeah,
saw,
me neither.
where the breakout rooms were in activities, but it didn't list the room choices for me.
That's fine. Like I just start dragging people's names. I just need the list.
Jonathan, this
Can you see the list? Okay, I have it shared.
Yes,
need
I see
to-
the list fine.
in affordable health care. Melanie. Or it says to me, you.
I think I need help too. I'm not seeing, where do you go to get in the breakout room?
Yeah, I don't see that.
I don't think we can assign ourselves. I
No.
think that we need to
Yeah.
be.
It'll just come up once it's assigned.
Oh, okay.
When I
It's not-
hit the one that came up, it knocked me out. It said you have to go to the main meeting first, which obviously we were in, so.
It hasn't been assigned yet. That's why we're not
Okay.
in.
Okay.
Okay, I see what happened here. So for those of you who don't have Google accounts directly, I have to move you. I got it. Give me 1 moment.
Oh, yeah.
Thank you guys for sticking with us. I know technology is not super fun sometimes.
So I just noticed that I went to breakout room 2. The rooms when you go there aren't named, and then over here on the spreadsheet on the screen they're not numbered.
Right. I'm going left to right, 1 through 4 currently.
Okay.
Scott, I was trying to get into your group, but I was prompted to join the healthcare group. So I'm going to wait here until they put me in the housing group.
Yeah, I was directed to 3, and I need to be in financial security.
It looks like 3 is financial security.
Yeah, that's what I'm seeing too.
Now, when I went there, I got housing.
Oh.
All right. Well, how about this? I am going to do the assignments, call everybody back. I named the rooms this time, so it's not an issue. And then we'll send people where they're going to go. So let me close that and then just put everybody's name so that when we open them again, it immediately sends you where it's supposed to go.
Awesome. Thank you.
Is Ruth?
Okay, we're still waiting for folks to join breakout number 1. Tiffany?
Yep, we had to call everybody back. There were some issues with the breakout rooms, so we're calling
okay.
everybody back, and then JJ's going through and assigning everybody to the
Okay,
correct.
I apologize.
It's all good.
Let's see here.
Just gives us more thinking time about all of the questions and conversation topics that we're gonna
Yes,
be bringing up.
indeed. Andrew, what's going on?
Yeah, I'll share just a quick point on something that Dan had raised earlier, because he had asked about what if we come up with a solution that might be of interest to another work group. I know that just kind of operationally here at the Department of Aging, what we can do with that is we can bring that to the stakeholder advisory group, and we can bring up any comments or concerns that we might have for those other groups. So I know normally I'm on the optimizing health, wellness, and utility subgroup. So if there are any issues of healthcare affordability or healthcare systems that might be more of interest to that group, we can go ahead and flag those in the main meeting here as well. And I would appreciate that because it helps us know that there's something we can discuss if conversation runs dry in those other committees. So thank you.
Thank you.
Ruth, yeah.
So we're still waiting to get into the groups?
Yep.
I'm doing the last
Okay.
access list for the last
Okay.
group right now. We'll be ready.
While that's being set up, can I share something that I learned in our breakout? We were working under the premise that we would still have the chat from the main room in our breakouts with those lists that you shared, and we don't actually have that. I was able to copy the housing bullet points, but if someone's able to copy the other group bullet points, it might be helpful to those groups' work.
Yeah, absolutely. Or if you have access, you know what I can do is share the link. Oh, I can't because I'm sharing my screen. But Izzy, could you maybe drop the link to the work group packet in the chat? And then if folks could pull that up, because everything is on page, let's see. It starts, our work group starts on page 8 of the work group packet. Or we're like 8 and 9. And again, if people have other ideas or whatever, those are certainly, we're open for discussion. Join break.
Okay. Somebody hit the button real quick. So open it up. You should have seen it pop up based on the list here and see if I got it right. Oh, things are going well. Ah, Case. Okay, I need to put you somewhere. Mike Case. Which room were you supposed to be in? You are muted. Sorry, I can't.
3 with financial security.
All right, see if you get the pop up. Carl, which room were you supposed to be in? I'm seeing some of the names here that are odd. And you're muted, sir.
I was with the financial security group.
Chelsea Heyman, yourself?
Affordable housing.
Patricia Jacobs.
Healthcare.
And Clary Lewis?
LTSS.
Ann Johnson.
Yes, LTSS. So I think I'm where I'm supposed to be.
And then Stephanie.
It's me, it's affordable health care.
I apologize for messing up your name. And Robert.
Affordable housing, please. Thank you.
Affordable housing. Got it. Where they're supposed to be. All right, so you should have seen pop-ups. There it goes. And then same thing. And then Andrew, Mark, Peter. Mark.
Affordable healthcare, me.
I have a meeting with the secretary at 11, so I'll double up and just support, but I'm happy to be participating.
Understood. Let me put.
JJ, I need you to join. Oh, no, I'm sorry, Jay. I need some staff people to help staff the subcommittees. There's nobody in healthcare. Peter, can you jump into that one, or Mark, somebody?
Yeah, I'm doing everybody's stuff right now.
All right. Thanks so much.
Yep.
And I'm going back, if I can figure out how do I go back to my breakout?
Bottom right hand corner, you still should see your activity, and it should be available to you. Go to breakout rooms.
I don't see
JJ,
that.
I'm supposed to be in financial security.
I'm supposed to be in housing, and I don't know how to get there. Okay. JJ, can you see Stephanie's question?
That should be in healthcare. Okay. Done. Save. And that should do it. And Stephanie, that oh perfect.
Right now, in fact, there was just a national village to village conference that just happened yesterday and the day before. And it's really, really catching on. So there are some innovative models out there that are addressing stability that I think would definitely be worth including in the objectives.
So the objectives, as we're going, I'm sorry, I'm looking for my work group sheet here. So the objectives that we're working on will ultimately be boiled down to strategies that will be broken down into short-term, midterm, and long-term. So short-term, like 1 to 3 years, 3 to 6 years for medium term, and 7 to 10 years. And I think that's where we're going to start getting into strategies on how to meet those objectives. So if our goal or overarching goals is preparing Marylanders to afford the 100-year lifespan, how do we do that through affordable housing? And then once we get that objective, then I think we can start talking about, okay, villages, because we're going to have, sorry, I can't. So it shows, I know it's terrible that I'm showing it this way. Oh, actually, I think I might even have it up on my screen. Yeah, here we go. So this will give you an idea of what the strategies are going to look like. There we go. Can you guys see what this looks like now? So it's the work group goal, the recommended objectives. And then as we scroll down, the format goes into those, so for objective 1, so this would be the one that we're coming up with, we're going to get into those strategies. And so that's the more specific of how. So we want to keep the objectives relatively broad. So the goal is the super broad part, relatively broad objectives, and then really specific, like supporting the village model XYZ. Does that make sense?
Yeah, you did say that the objectives needed to be measurable, though. And I don't know to what extent, as phrased, they would be considered measurable right now, but maybe that's something that just needs to be worked on.
Yeah, absolutely. So, well, we don't have the objectives yet. So that's what we need to work on. And then we can, as we're developing those, we want to make sure.
I apologize. I thought that these were the objectives.
Oh, no. So these are just, I think, bullet points to get us started thinking about what those objectives might be.
Okay,
yeah,
I misunderstood. Okay.
We're here utilizing everybody's expertise to develop those objectives.
Got
Allison,
it.
I saw you had your hand up. Did you have your hand up?
Izzy, did you have a comment? I don't want to cut you off.
Go ahead, Allison.
Okay. Well, I just wanted to get in at least a few thoughts since I have to leave the call a bit early, and I will put some things in the chat, so I don't want to take up a lot of the airtime, but I was just thinking about, because we represent a lot of not-for-profit affordable senior housing providers across the state. And so I hear from them about the challenges that they face. And so there's a couple of areas that I just wanted to throw out and mention. I don't know where they fit into kind of the objective strategies piece, but I think that one area that is really important is that, and I know this is something that I think DHCD is working on, is to really identify and quantify the supply and the demand. So what are we talking about here? How much affordable housing for older adults do we think we need? What do we have right now? And also to define what we mean by affordability and for who, because that it's affordable for one person is not affordable for the next person. So what are we talking about? And then I think identifying what are the state level levers that we even can make a difference in. So what are kind of our tool belt of things we could be thinking about? And then one of the pieces I also wanted to highlight was just around preservation of existing affordable housing. And I think that it would be important to kind of have a way to map and track the properties that are currently affordable and any that may be at risk of no longer being affordable, and have rehabilitation programs to support properties that are struggling. So I know there was a lot, but I just want to get it out since I can't stay on for the whole meeting. And I will write all of this down as well, Tiffany, and send it to you.
Amazing. Thank you. So it sounds a lot though about quantifying the supply and demand of what we currently have, because that's really going to inform our direction.
Yeah, because I think we all know that we need more affordable housing for older adults. But it's hard to get the exact data to say this is how much we need and what it looks like and what we have, and because it exists so many different places. So that has been an issue for us in trying to actually quantify exactly what the need is. And I think Scott mentioned they're working on kind of the state housing needs assessment piece, and hopefully that could be a part of it. So yeah, I think that having that data is really important though, so that we can track how we're doing.
Yeah,
that's great, Allison. I think just to focus those seem like things that would be strategies to support what our one objective we want to identify to work on. And as it was framed out under the work group recommendations document, you all have this, but what we want to do is by 2035, we want to, as accomplish what with regard to affordable housing. It's our one thing that we want to identify as the overarching objective around affordable housing. And then behind that, right, as Tiffany said, the measurable things that we would need to support getting to that objective. And I know there's been some work.
The current administration, the current Department of Aging, to really join the fight and make Maryland a leader nationally in fighting for parity in Medicare, behavioral health parity in Medicare. So there's a few things.
Great. Okay, Melanie, we can hear your suggestion and recommendations as well.
Okay, we're talking about affordable health care. Well, many Marylanders who are older are on Medicare, and Medicare alone is really not affordable because you have to have a Part D for your prescription care, and there's a donut hole there. An Advantage plan that would be extra costs out of somebody's pocket, which we're on fixed incomes. So that's really not doable. And unless you are a dual Medicaid, Medicare, you get more of your costs covered if you are dual Medicare, Medicaid, but most people aren't. And so healthcare is not affordable. The eligibility, financial eligibility for special help, I think when you get people who are on fixed incomes, when there's like $20, $40, $60 difference between you can get extra help or not, those should be eliminated. There should be everybody who they should have extra help.
Do you need to get back to your
They
worker?
should not have to pay for additional premiums for services that are not covered. Which one is oral dental care? Does that make sense?
Yeah. So for Melanie, I have here Medicare is not available for older adults, and you're proposing that.
I'm proposing that eligibility
where there's no
eligibility requirements for extra help, like in paying your Part B premium out of your Social Security check. The state should make a way for us to not have to pay that, because every dollar that's taken out of our Social Security is precious and can be used for other living, like food costs. And as we age, our dental health declines, and it makes it hard to be able to bite, chew. And Medicare does not cover dental or oral care.
Is how do we help Marylanders work longer to support themselves and not have to be,
And
head
I
on the
think
city.
some of that can also be education, like the reality of retiring at 62. Like we even talk with higher income clients where it's like if you want to retire at 62, like that's like 40 years that you
Yeah.
might have to live on savings. I mean, that's an incredibly long time to save for most people, as long, if not longer than they were in the workforce earning.
Exactly. Yeah. That's
So that can be part of education as well early on. We're like setting the expectation that, starting saving early and working to 67, plus years old is
well, I think they should change the retirement age to 70. I mean, skip to 65. I think that you're going to see that happening. I've heard people lose their health when they quit and do nothing. There's just, no rewarding.
I think another part of it is transportation. A lot of older adults maybe have lack of transportation and getting around.
Doctor visits.
Yeah, doctor visits, grocery stores, just the basic things. I'm in like a nonprofit community organization. I've been around for about like 30 years in this arena. And that's one of the biggest problems now with older adults is just getting around.
How does that fall into affordability?
Well, that falls into affordability because if you don't have transportation, you can't do anything. You can't even get to the job. You can't even get to the doctor so you can have the work. That's one good thing about the Zooms and these types of things that we're having now, but a lot of people don't have access to this.
So we're looking at affordable transportation.
Yeah, affordability
For
for
seniors.
transportation,
Yes.
affordability at a young age to keep the benefits at a lower rate that you have it. You get the insurance when you're like 30 years old, it's like $25, and if you wait until you're like 40 or 50 to try to get the same insurance, it's hundreds.
Are you talking about health insurance or car insurance?
No, I'm talking about like long-term care
insurance.
Long-term care insurance.
That's always expensive. That's a
Yes,
good point.
it's outrageous, and it don't let a person have like a healthcare issue. It's just like out of the park. If you don't have like Medicare or something like that, you're like done.
Right.
You
So
know?
affordable long-term care.
Long-term care insurance, and there are some states around the country that have incentivized and provided tax credits for long-term care, for holding long-term care insurance. That world is changing. Long-term care insurance, there are very few carriers left that are providing that. It's kind of shifting to life policies that have sort of a long-term care rider. And, you know, maybe just indicative and informative of our conversation here, the reason carriers are getting out of that business is because it is too expensive for them to keep up with the claims that the statistic is like, if you live to past 65, there's like a greater than 70% chance that you'll need long-term care before you pass.
It's inevitable, right?
Yeah, so that doesn't really, when you think of 70% of policyholders going on claim, that's not really how insurance works. So even that is becoming a difficult landscape.
So maybe this is something the state needs to have programs in.
Yeah, and I probably have some resources to explore what other states are doing through other associations I'm involved with, but it's definitely something that, you know.
One other thing here at 211 Maryland, we're the helpline for health and human services, and housing issues of all kinds are the largest, by far, the largest driver of calls to our helpline. It also is the area where we learn from our follow-up to callers where there's been the most unmet needs. All of these issues, the wait lists for housing, the issue of those who are in some of the senior housing are not allowed to have family members stay there for any extended period of time. The other thing I wanted to just put on the table is we get a number of calls from people who have wound up in unlicensed assisted living facilities, and the number of abuses of all kinds that are happening, including things like having to have assigned all their benefits over to the persons running these assisted living facilities. And, you know, that's another thing that is happening. And I know that the new, or fairly new elder task force that the governor has set up, I know they're working on those things, especially working to make sure that hospital staff isn't discharging patients into unlicensed facilities like that. My point of view, my background kind of causes me to look at long-term services and support as extremely detailed in the number of services that are needed. And I did share a spreadsheet to the whole group yesterday that listed all the calls related to older adults that we received in 2023. And you can see all the service requests that came in. And I don't know if it's of use to our work, but
I think it would be. I'd love to see that.
Okay. Yeah. So do we have the email addresses for our subcommittee? Is there a way that I could directly share that? Just as more background information that might
Yes.
be
Yeah.
useful.
And I actually received, I'm looking at it, I received the list that you sent yesterday. I don't know if others did also.
What information are you referring to?
It's just a data report on the calls received by 211 Maryland that were related to the needs of older adults.
Yeah.
So even things like people couldn't feed their pets. Is there any free pet food somewhere? It really, and all the housing requests, all the need for food. So
I think a lot of the problems.
If there was something that we could try to provide for you.
but it sounds like you have them.
I think a lot of the problems really are based on the fact that there are just scarce dollars available to provide the services that are needed. That's why there's waiting lists. That's why there's limited hours for providing home care. And so one issue is whether there can be more resources somehow devoted to help solve these problems.
I mean, and not addressing them in a more recent way, people are ending up going into nursing homes because there's no other option. And then the state's paying, 10 times more anyway.
Well, that we raised that argument when we tried to get the home and community-based service waiver program expanded. But I think from the health department's perspective, they're not sure someone will actually need a nursing home until they're actually in the nursing home. And so they thought they'd be just spending more money for people who would be in assisted living. I don't agree with that argument, but it doesn't seem to convince them of the need for more services outside of a nursing home.
Services outside the nursing home would keep people in their homes longer. I've been talking to a woman that's been calling me from Harford County, and I know the city is in the same predicament where she needs some repair work done to her house. She's living on one floor. She doesn't go in the basement because she has snakes in her basement, she said. And also she's not sure whether her 40-year-old washing machine even works. She's been washing her clothes by hand and drying them. And, and she called the Harford County. I gave her a resource for their repair, their site for home repair. They said they were out of money. They're not even taking applications.
Baltimore County has a similar program that works with Civic Works to get home modifications and repairs done too. And I think their contract just renewed. So hopefully within the next couple of months, I don't know what their fiscal year, if it's July to June and then they're still out, but hopefully they're just out until January.
It just said it's closed for applications. It doesn't say they're out of money, but
right.
So I am going to step off, but JJ is on the call and taking notes right where I left off. So I actually, JJ emailed you the documents. So if you want to reopen it, you can do that as well.
Thank you, Mark.
Thank you. You guys are great. And thank you for brainstorming
Thank you.
on this. I know this is a monumental task, so I appreciate it. Take care.
I also just wanted to bring up a point. I know in senior living, we normally, in some of our buildings, you have independent living, assisted living, and memory care that's all in one facility. And we are the eyes and the ears probably for the family members and most of the residents, and being able to direct them when it's time to move to an additional level or having some other services that comes into play, like physical therapy, occupational therapy, or if they're needing maybe memory care support through a memory care clinic or something, but still is very much able to live independently, right? What is not happening is I don't see that loop in the services when it comes down to the community. Outside of our community, the aging adults that are calling in and talking with us about things that they're seeing or is happening in their home. If I was a social worker or someone that is able to go into the homes of the aging adults that are calling in and then find out that all they really need is that one thing, it just makes it a little bit easier of saving the money for a longer extended time for when they are actually needing some help, to being able to see that the person is having some ambulating problems or something like that, and they can't really move around in their home. That doesn't mean they're not independent. Maybe it's now time to downsize, come out of that home and go into an apartment instead of something with stairs. it's not more so of modifying the apartment, but modifying their situation. But I think that we don't catch it at the beginning, and we end up catching it when it's an emergency situation and that person is now forced out of their home. But if we would have caught it at an earlier time, it would have made it a little bit easier on I guess the money wise for that person, that is aging. Just a thought. If we can kind of break that loop and get some services in there where we're spotting things earlier, kind of helping them along, it would kind of slow that progression down. And then it's not, now we have so many people right now that are calling in who can't really afford even the services here. And I'm turning them away and not really having any resources to be able to tell them, try this,
Well, one thing you could do is have them call the Maryland Access Point office in their county, because that's what we do, is we screen people for the services and benefits that are, countywide, statewide, federal. That's what we try to do. But like you said, a lot of times we're getting these calls so late that there's nothing immediate available. And so there is this gap that people are facing. But the point of MAP was to be kind of that single door of entry for the state. So each county has their dedicated office. Just refer them to there. That's what we do all day, is take calls and try to connect them to services.
Well, do you think the biggest problem with connecting them to the services is the availability of funding?
Yep, everything's overburdened. There's
Yes.
wait lists for everything.
So by the time they would get the service, you don't know if emergency will come up. Like
Right, but in the meantime, there are other things that might bridge the gap. Like there's a caregiver stipend that has, several $100s that can maybe get them some help that week, or, getting them connected to DSS's in-home aid services that will do sliding scale. DSS has respite services in our county anyway, in Baltimore County, of up to 140 hours of reimbursement. So there are these little programs we can all try to piece together to deal with that crisis or emergent moment. We're not going to get everyone, unfortunately, some people end up going to the hospital. But what we always say is that we're like the room of requirement in Harry Potter. Like if you call us, we're going to find something for you. We're going to find something to give you a little bit of relief. And then get you on those wait lists. And that's why we do a lot of outreach to the adult children to say, hey, be watching for these things, because, they're going to need the services eventually. So get them on that registry, get them on the Medicaid waiver registry now.
So Carrie, is there a way that Anne and the 211 folks can begin to refer people who are calling in to help to the resources you just mentioned?
Oh, yeah. They
Okay,
do
that's
all
right.
the time. We get a lot of calls from 211. We appreciate the partnership.
But what about also getting the information to congregate care sites and places where older adults might tend to be anyway? Because it feels
we're located.
yeah.
Mm-hmm. We're located
No, I was just saying,
in the main senior center. So we have, all of our senior centers in the county, and we distribute all of our brochures and things there. We do outreach things. We do tables at church fairs and schools and, police night and all that kind of stuff. But there should be more. Absolutely. There should be more. We had someone walk in yesterday and she said, how would I have known who to call? And you don't know until you need the service. So like Morris had said earlier, how can we kind of intervene to let people know to start looking before they need the service, what's available out there and how to access it?
Absolutely. Okay.
I found some of the toughest cases are people who don't have any family members, the surviving spouse, and the children are moved away, or they don't have children at all. And it's very difficult for them to advocate for themselves. And maybe part of how you access LTSS is to make sure that somebody does have an advocate for them, or a decision maker for them. So if they're incapacitated, someone can act on their behalf.
Yeah, it seems,
where they're going to lift that issue up. It may not be under affording longevity. It might be in under another one, but we'll find that out as we move our notes, our summary information to the overarching group.
So JJ just put in the chat. So we're nearing the end of our discussion. Summarizing key points and nominating someone to share a brief overview. Anybody interested in kind of sharing the overview that, and we've both, I think, Izzy and I have both been kind of taking notes and documenting all of this. And these sessions are also being recorded, right? The subgroups.
Actually, Tiffany, they are not.
Okay.
That's another thing that we discovered about Google is that it does an auto transcription thing for the main group, but the subcommittees it doesn't, which is why it was so important that we had some staff in each subcommittee to make sure that we capture the high points.
Perfect. And I don't know, let's see, I don't, all messages are deleted when the call ends. Okay, so the chats too. So I just copied and pasted everything that was in our chat because I know some folks put it in and stuck it in my notebook so that we don't lose that either. And I'll make sure that I add that to my notes as well. And Izzy and I will get together and.
It's not just what you eat, it's how you eat, right? So eating together as a group, all that helps. So my nourishment, and not just what you eat, but how the setting in which you eat. And then you had go ahead.
There could be a link up with communication and education here too, to make sure that older adults are aware of SNAP benefits and other things that are available to them.
Yeah.
That they may not know.
Yeah. Yeah, we have a program over here, Congregate Meals, that we, that allows people to. So yeah, all those things, go hand in hand. And then your other thing was social isolation, where and your recommendation was a peer-to-peer kind of group, village setting groupings, community set grouping will help.
Right. Also, we could be advocating for primary care providers to be assessing for social isolation. There are some well-documented ways to do that with just 3 questions in a basic healthcare setting. So we could be identifying it a little better so that we would know who to focus on.
Primary care. And then technology was the last one. Not only just the technology, but, creating apps and programs that are, that senior or older adults can use. So we have to create programs and applications, create platforms that is more amenable to the usage of the older adult population.
Right. And
I am a Kinect learner, so I like to always be typing. But yeah, just what I'm seeing so far is the summary. Oh, yes, thank you, Jonathan. Or thank you, JJ, sorry. Yes, okay. Yeah, so the 2 points that I think we've kind of nailed on are, or at least what it seems like from my end, is that we need to improve education as far as financial resources, and then we need to improve the visibility of the resources that are out there. Does that sound?
Well, as Annie said, yeah, we also, or somebody said, we also have to increase the employment, long-term employment.
Yes.
Is that correct, everyone?
So I think we should be back. I don't know about you, but I feel like I've been through time warp or something, some kind of sci-fi movie, and now I'm back.
with all of you in the main group.
Yeah, good to see everybody. Hopefully, everybody got a chance to get some really good discussion in, narrow it down. And I'm sure you guys are all ready to report out on your super refined, ready to go and stick in the plan objectives, right? So what we will do is turn it over to the point person from each subcommittee so that we can kind of get some brief summary of what your group talked about and maybe the direction that we want to go in. Would anybody like to start?
I'll start just to get it out of the way. So
okay.
And I'm gonna my group is the Affording Healthcare group, and so I'm gonna look to my other partners on the group, Robin, Patricia, Melanie, and Stephanie. If I miss anything, just jump in and let me know, because I'm gonna again try to be really high level here. We had a good conversation about a lot of different things. I think overarching in terms of kind of again making sure that healthcare is affordable, for older Marylanders and others. It kind of comes down to a few things. Reducing expensive and unaffordable hospitalization and facility and institutional care, improving kind of insurance, the kind of insurance that older adults use, increasing education and awareness around different options and things that they have available to them, and kind of expanding service access in key areas. And so, I'll go into some of those things. Really making sure that there's access to mental health and substance use care for older Marylanders is key. Again, that's key to reducing hospitalization and facility care, and building out a system of care, behavioral health care, of home and community-based supports for older Marylanders is key. Reducing social isolation is a key to kind of again improving mental health of older Marylanders, reducing healthcare costs. And then, really we kind of got into the kind of Medicare, which is obviously a federal program, but, I think we would really encourage this administration, the Department of Aging, and everyone else to kind of join the fight, and the federal level to kind of improve Medicare, especially when it comes to parity in mental health services through Medicare, and also dental coverage. There's no dental or oral coverage in Medicare. And so, and there's a lot of strict eligibility requirements for extra help through Medicare for people that do have Medicare that recommend eliminating to the extent possible. Access to affordable transportation is key, so people can get to appointments and things like that. Education about kind of different insurance coverage options and that they have is addressing malnourishment is a big issue that came up in our group. There needs to be awareness. There needs to be awareness about kind of available options for addressing malnourishment in different settings that folks can eat in congregate settings. Technology was a big thing. They want to increase use of technology, especially smartphone-based programming and outreach for older adults in terms of home monitoring, medication management, things like that. Again, to help improve health outcomes before the need for hospitalization. And then communication and education, build awareness about different SNAP benefits and things like that. Things that again that can improve their health and make sure that they are well before the need for higher or more pricey levels of care, like hospitalization, facility-based care, institutionalization, and things like that. So those are the kind of big things that we covered in our group. And like I said, if I missed anything, folks, please jump in. I try to cover everything in a few minutes to give everyone else time too. So.
Thank you.
Anybody else want to either jump in and add to that, or that was in that work group, or should we move on to the next work group subcommittee?
Dan did a great job. Move on.
Awesome. Okay, let's move on. So who wants to go next? Was in the affordable housing work group. subcommittee. And so we talked a lot about different solutions that might be out there. So, but to start with a very, very high level, all of them kind of had the common themes of preservation and stability. So not just, preservation of multifamily housing, but also preserving existing housing stock where older adults are living, making sure that from that stability standpoint that people are able to stay in the home of their choosing, whether that is a single family home that they purchased forever ago, or if it's a rental apartment in an affordable housing community, but making sure that they can stay there. And then also it's about, like I touched on, a home of their choosing. So it's about options and choices, not only having them, but educating people about what's out there so that they can make the choice for the option that's right for them. And then safety and livability in general. And so that kind of goes back onto that stability piece. So making sure that people are able to stay in the home of their choosing safely, because we have this, housing stock that is maybe it is through home repair and modification programs. Maybe it is through access to different supportive services that can come into multifamily housing communities or individual homes. And then also going back to that housing stability, making sure that we're addressing the needs of homeless individuals who are experiencing homelessness, because older adults are a very fast growing population that is experiencing homelessness.
Those at risk of homelessness.
Those at risk of homelessness, yeah. And then communicating, so I have communication strategies about the options that are there, home repair programs, different village models that can improve the livability and stability. And I think that pretty much covers it. So we have sort of some common themes and some direction in which to go in to kind of narrow things down. Did I miss anything, anybody? Great. Let's pass it on to the next subcommittee. Who would like to go?
I can do the
Great.
financial security. In our group, it was brought up that the progress that you make in the other work groups are going to affect the overall financial security. One of the main things we came up with that communication and education and programs that are already existing or that we come up with is so important to all members of Maryland. And that perhaps the education in financial health should start in the high schools, where there's a program where students can't graduate unless they've taken this life skills and in all financial aspects. Start there. Then also would be in giving maybe incentives to employers to offer financial planning or something like that, so that they can start thinking about things. The other was the working longer, having Maryland's retirement age, go up, or take away the problem that when you hire someone over 40, if you fire them, you get sued, adjusting that. So that allowing and giving incentives for employers to hire older workers, which are wonderful, and it helps the employer as well as the employees. I think those are the basic things that we came up with. Anybody else can add?
Can I add something to that real quick? Some, especially in Baltimore City, and I'm seeing this a lot. I have people that were doing task jobs most of their life, and they don't understand about paying into Social Security and paying into, Medicare. And then they come of age where even if they, get the Medicaid and, where and the QMB, where the state will pay for their Medicare, what they get in Social Security is $600 a month. And, you know, they can't live on that. And they don't know. You don't know what you don't know. And they didn't know that, oh, I'm not going to get Social Security because I didn't pay into it. So you're correct. In education in high school, if you do not pay into this, this is what you're going to end up potentially. And I've just seen it over and over and over again with older people.
Absolutely. And it should be mandated by the state of Maryland. I tried in Montgomery County to get them to do something about it, and they said they didn't have time in their curriculum. So
maybe we will be able to address that in our holistic plan.
Yes.
But probably not in the next 5 minutes because that's when our meeting cuts off. So I want to turn it over to the final work group so that we can make sure that we get a chance to hear from everybody. Who is the point person?
I didn't really have one because the person was supposed to be there wasn't. So I don't have the document of the notes that JJ and Mark were taking. But we did talk a lot about information and referral, outreach, and education for access, just because you don't know what you need until you know. And just having that outreach maybe to, again, people at an earlier stage or adult children or high school, getting the word out that there are services to screen for. Obviously, programs are overburdened right now. And so that's been kind of a barrier with people to gain access. The wait lists are everywhere from senior apartments to, you know, the CO registry to senior care to all of the programs. We said that there was such a good outcome when CFC and CO waivers started allowing family caregivers, that there was definitely an ability to keep people at home with people familiar to them longer. What else, guys? There's such a time lapse for reviewing and approving plans of service and things like that to people to get the services. They may have applied for CO waiver, but they don't get the service initiated for a year or longer because they're waiting for plans of services to be approved. What am I missing, guys?
There were just some things dropped in the chat too.
Oh, okay. I wanted to add that many of us are immersed in the crisis of what's happening now. And I think it was Morris who kind of was good at focusing on the fact that we need to be thinking about what could be in place to work on these issues going forward. And he also mentioned the example of Washington State, that they at least tried to have a public long-term care insurance. And maybe that is a discussion we could advocate for in Maryland, that kind of thing.
Great. Anything else that we missed?
Yeah, the family of staff option too, we discussed.
All right.
Can you articulate, like, describe what that is?
Well, I mean, there are some, like the sandwich generation, you know, where you may have to lose your job or leave your job, you know, as a result of taking care of children and, you know, an elder family member, or, you know, and allowing, you know, family to be a staff option, you know, as a caretaker, so that, you know, you can get additional resources for that.
The way CFC and CO started to allow with pandemic.
Right. Got it.
Yeah, I think it should say family as, not of. Family as staff.
Yes, sorry about that.
I understand that. So Tiffany, let's hit on next steps.
Next steps. Yes. Am I covering next steps or are you covering next steps?
I'll help you.
Okay. Let me pull up my
notes
here. Sorry, I'm switching my notebooks. Okay. So our next steps, that is really, so sorry, guys.
Okay, our next meeting is Friday, October 11th from 12 to 1:30. The invites, I'm going to make sure that everybody's got that. I'm also going to make sure that we've got the technical coordination down better and sharing documents better. We definitely want to take everything that we've captured today and format it in a way that kind of summarizes and maybe articulates a measurable objective, if possible. And if we can get consensus around those things, we can work on developing and identifying the strategies. That right, Tiffany?
Yeah, absolutely. And I think a lot of just in the conversations and what I'm hearing in the summaries, it sounds like a lot of good strategies came up and a lot of like folks have a lot of good ideas. And so, right, I hope that we can kind of summarize this to some extent, and then maybe use the next meeting to sort of come up with firm up objectives. And then the last meeting, we'll work on the strategies on how we're going to meet those objectives. But thank you guys so much for your time today. I know we're like a minute over, but I think this was a really great discussion. And if you think of anything in between time, you know, you have my and Izzy's email addresses. So
Yes.
Please don't hesitate to reach out. I know a couple of folks actually have and shared some information, resources. So we appreciate that very much.
Yes, thank you all for your time. And we
Thank
look
you.
forward to continuing to work together. Thank you.
In a couple weeks.
Have a good weekend, everybody.
Okay. Bye-bye.